I'm Emily Walker in MedPage Today, reporting from Washington. An Institute of Medicine panel met today to hear testimony for a new report it plans on issuing in September. That report is meant to be a guide for healthcare workers to let them know what level of personal protective equipment, such as gloves, gowns, and surgical masks, they should be wearing to protect themselves and their patients from the H1N1 virus. After the hearing, I talked with an emergency department physician who's based in Atlanta, Dr. Alexander Isakov, to get his take on what he thinks the IOM should recommend.
The IOM has really come together today to consider the evidence on the appropriate personal protective equipment for healthcare workers dealing with patients that are suspected to have the novel H1N1 flu. And it's really important that they've come together to consider the evidence because currently there are recommendations which were appropriate early on in the epidemic and pandemic that were promulgated by the Centers for Disease Control and Prevention, which included very conservative protective infection control posture, which included an N95 mask, goggles, gloves, gown, and there's hope that with new information that they've been able to discern from the flu outbreak in the southern hemisphere that they might revise those recommendations and arguably make them less onerous for healthcare providers trying to care for their patients.
The IOM and the Centers for Disease Control and Prevention made draft recommendations at the onset of the H1N1 outbreak that call for strict protective measures.
So the current CDC recommendations were based on the fact that there was a novel influenza virus. The means by which it was transmitted from person to person were really unclear. And so they took a very conservative approach about how healthcare workers needed to be wearing personal protective equipment when they interacted with patients. So essentially what that meant was that for every patient encounter, let's say you had the flu and I was your physician, once you were identified in the waiting room and then put in a private room, we would put a mask on you. Then every patient interaction I had with you, if I wanted to come and speak to you about your care or give you some advice or recommendations, I would have to put on goggles, an N95 respirator, gloves, and a gown to walk in and speak with you. The biggest difference between how the CDC has recommended this early in the outbreak and what, for example, the World Health Organization has recommended, for me to have a similar interaction with you under different guidelines, I might just have to wear gloves and a surgical mask, which is much different in terms of the time I need to spend putting on gown, gloves, goggles, mask, just to have a conversation with the patient. So one set of recommendations is more conservative, but a little bit more onerous from a feasibility and operational perspective.
Dr. Isakov treats patients at Emory University's hospital, which follows the stricter CDC measures. He also treats patients at a public hospital in Atlanta that follows the less stringent WHO recommendations. Because
there are disparate recommendations today about what are appropriate protective posture for healthcare workers, one promulgated by the World Health Organization, another by the CDC, and even some state health departments breaking from the CDC's guidance today. As an emergency medicine faculty, when I work in one hospital, I'm working under one level of healthcare worker protection, and when I work at the other hospital, I'm working on a completely different level of healthcare worker protection. And so for me and my colleagues and other staff, that's understandably confusing. So we're hoping that review of the evidence by IOM will help clarify that. I'm hoping also, just as an emergency medicine physician and knowing what it takes to be in compliance with the current recommendations as opposed to a less stringent recommendation on healthcare worker protection, that we can have enough evidence to actually ratchet back the level of protection required to work safely in our environment.
Dr. Isakov explained how being required to wear so much protective gear can interfere with a physician's ability to provide prompt patient care.
One, I think it decreases the likelihood of physicians, nurses, and other healthcare providers interacting with the patient because it just takes more time to put on the gear, go in and have a conversation, then take off all the gear appropriately before, obviously making contact with the next patient, and then having to do it again if I wanted to come and have a conversation. So I think it has an effect in decreasing healthcare worker-patient interaction, especially in the emergency department. The patient that required full regalia to have an interaction, I think often waited longer in that room waiting for some healthcare provider to come, because in a busy emergency department, that healthcare provider decided it was easier to deal with 3 other patient issues that didn't require all of that intervention than go and see that other patient. That's just an anecdotal observation. The other observation I have from the patient perspective is that it's If the evidence doesn't support an N95 respirator, goggles, gloves, and gown for me to see you if you have flu symptoms, then we should probably follow the evidence and change that recommendation. Because for the patient, it's also curious or confusing why, after evaluating you in full regalia, then I'm discharging you to go catch a bus home. And that's confusing as well. And so I think matching the guidelines with the evidence is really critical.
There is little evidence on how well an N95 respirator, which is meant to keep harmful airborne particles out of the lungs, actually protects against flu viruses. Still, others at Wednesday's IOM hearing pushed for requiring use of the N95 respirators among all healthcare workers, from doctors to EMTs to nursing home staff, who interact with patients who have flu-like symptoms. N95s are cheap at about $1 a piece, and they may keep healthcare workers and patients safe, a number of speakers said. The IOM will make its recommendations to the CDC by September 1st. From Washington, I'm Emily Walker, MedPage Today.